Hello, folks. I'm Dr. Fazil. You're watching 2025 August edition of Dr. Fazil Show. Before I go further, so the topic for today's discussion is protein in the urine. Protein in the urine or proteinuria. Folks, I'm an internal medical specialist as well as have a background in cardiology as well as general cardiology, as well as emergency room medicine. I used to work as a ER doc in Brooklyn, New York. Seen a lot of trauma there, and also I'm a kidney specialist and a nephrologist. So that bunch of different facets of medical sciences and exposure gave me a lot more understanding of the human body and ability to understand the problems and intervene early. So, folks, let's talk about that topic today. So, protein in the urine is not uncommon problem. It could be due to many reasons. You have protein in the blood, and then you don't have supposed to have blood protein in the urine. But there's a membrane in the kidney which protects that. But if you start to have inflammation in the kidney, we call it inflammation. Common examples are, for example, diabetes, right? And it will start to spill protein in the urine. Initially, it's going to be slow, and then it's going to be more if you don't intervene. So, what are the symptoms? Like, it could cause foamy urine. If you pass urine, you will have foam on the top of the urine in the bathroom, in the commode. And if you have too much protein, it can cause actually swelling in the legs, edema or swelling in the legs. So if you're having all those symptoms, obviously you need to see a kidney specialist, or if your provider can help you, that's fine. If not, have you been seen by a nephrologist or kidney specialist? Because this is the early warning sign. If it could be treated, but if you have to intervene, you have to intervene early. So the treatment is based on the cause. So first we diagnose, see how much protein you have it. If you have protein, how much protein you have it, and then we do some blood work for that, and then do a kidney biopsy and take a picture of the kidney with the sonogram. So that's kind of basic workup for protein in the urine. After we have found the source with the kidney biopsy and other diagnostic tools, then we can do the reverse engineering and fix the problem. Because if you don't, it can keep getting worse and worse, and you will end up having kidney failure and then end up on kidney dialysis. So we don't want to get there, right? Prevention is intervention, and prevention is the key here. Early intervention. Most common cause, as I said, is diabetes, but inflammation, genetics, and sometimes the medication. For example, NSAIDs like ibuprofen, protein, aleve, naproxen. They can also cause inflammation. Being overweight, if you're overweight, it can also cause protein in the urine because kidney have to work a lot more harder than normally they have to. Pregnancy can cause also the same thing. So protein in the urine is not just one thing, but it is end result of a lot of damage to the kidney. So folks, if you do have damage to the kidney, don't take those medications, ibuprofen, Motrin, aleve, naproxen. They are really bad for the kidney. And also less protein in the diet. It's paradoxical, right? That you're leaking protein in the urine, but you're eating less protein. But that's the way it is because kidneys do not like protein. They have to burn it, and they don't want to. We don't want to overwork the kidney. So if that happens, obviously, basic general rule is low protein diet. Avoid any nephrotoxic things which can damage the kidney, like ibuprofen, Motrin, aleve, naproxen, and then we'll go from there. So, folks, that was a few pieces of useful information for your kidney health. I will be back next month with more useful topic. And on that note, it was Dr. Fazil TV show. God bless you and God bless America. And have a nice rest of the month. Dr. Fazil here. Thank you.